My name is Dr. Kimberly Brown. I'm a licensed naturopathic doctor in California. My specialty is perimenopause. Tonight we are going to be talking about hypothyroidism and what happened, well, thyroid hormones and perimenopause. Also, I'm going to answer a couple of questions that were sent in. So first off, what is the relationship between perimenopause and thyroid? First off, I think we've talked about it before, that progesterone can decrease in the first stages of perimenopause. Progesterone helps create thyroid hormones and has a lot to do with the production of it. So thyroid hormones can lower in perimenopause in the start, and then if there's estrogen dominance, which also occurs in the first part of perimenopause, that will decrease thyroid hormones by interfering with the transport of them with something that's called sex hormone binding globulin. So it's a double whammy there. And that's why oftentimes we get a diagnosis of hypothyroidism in the perimenopausal years. The symptoms of perimenopause and hypothyroidism can be similar. So one of the questions I got was actually an older woman, but she said, all of a sudden I have brittle hair, dry skin, gaining weight. I don't know what it is without actually meeting with her, looking at her labs, but those are very common signs of hypothyroidism and also with perimenopause. So insomnia, agitation, increased anxiety, fatigue, weight gain, changes in metabolism. So really a lot of overlap between thyroid function and hypothyroidism and perimenopause. So I always look at both. Oftentimes, I think just last week somebody called me saying, "Oh, I think I'm perimenopausal." And I thought, well, you're a little young. It's a possibility in your late 30s, but possibly thyroid dysfunction. So whenever I'm treating somebody in their late 30s, 40s, 50s, I'm always looking at thyroid function. Very, very important. So that's the relationship between progesterone and thyroid hormones. Also, for any of you that are actually on hormones and hypothyroid, make sure your doctor is looking at your thyroid function. By actually starting hormone replacement therapy, it can decrease the availability of thyroid hormones. So another question, by the way, if you have any questions about this, please let me know. I actually really do enjoy working with thyroid disorders, hypothyroidism in particular. Let's see, another question, yes. A woman who sounded like she was perimenopausal, who also had something called mast cell activation, wrote in as to what do I do? Mast cell activation syndrome is complicated. It's something I don't specialize in. There are a few people out there that do. Certainly, you can get flare-ups in perimenopause with mast cell activation syndrome. It is something where your body releases a lot of histamine. So we won't go too much into that, but I did want to make sure I answered. Oh, I'm shaking the phone. Sorry about that. So I did want to make sure that I went into that. So anyway, great to see all of you that showed up. Thank you. And I look forward to doing this again. Take care. Bye.